Hello, thank you for joining me for the MCO and Public Health Team CRIS training around receiving the MPROF form for the IMHS project. So first we're going to talk about how to access CRISP. And so the best way to do that is to go to crisphealth.org. Once you go to crisphealth.org, this will be the main page that will come up. And then you'll click login, and then where you're logging in is in the CRISP portal. Once you click on the CRISP portal, it will prompt you to use your login credentials. I encourage you on that page to save that as a favorite so then it's easily accessible to you because you're going to accessing it more frequently. Once you do that, you will be oriented here to the main page of CRISP. So this is what the home page of the portal looks like. The main thing you're going to get is the first thing you're going to get is you're going to get an email that said you received a new referral from the ACCU team. So the ACCU team will be sending you copies of the MPROF form that they received from the providers and for you to manage and update those referral forms. And so the way that you're going to access that when you first come in here is to go to manage referrals. So when you go to manage referrals, you can access it a couple of different ways. One way is to come up here to search applications and type in manage and go to manage referrals. You can also go and click on one of the tiles down below here where it says manage referrals. You should not have the volume of tiles that I have, so it should be right there up at the top. So you will click manage referrals. And then it will come here to your overall work list. So once you have that overall work list, you will be able to see the different referrals that have been received. Over here, just to orient you to this slide, over here, it'll be listed by name. So these are test patients. So in the test patient environment, these will all just be different names of different people. Then you'll have gender, date of birth, referring provider, the referral date, the most recent status, when it was last updated, the organization name. So for that, if it's the MCO, it'll be the name of the MCO. If you are part of the public health team, it'll say your county health department is what will be there. Under program name for the MCOs, it'll be MPROG Care Coordination will be the program name. And then the program name for the health department public health team will be Care Coordination Public Health. So you'll be able to see the different program names based on what organization you're working for. You're also able to sort these by clicking the little arrows next to them. If you ever need to sort them by referral date or last updated, you can also just always click that arrow next to it. Then you can also select referrals for download. The reason why you may want that is you may want more information about the referrals. So this includes a lot more detailed information about each specific referral and the content within those referrals. So you would then manually select which ones you would want to download and get that additional information and click download those referrals. And that will then automatically pop up and you can access that information. You can also download the entire work list. So as you can see, there's 30 different referrals here. So if you wanted the entire work list downloaded with just the high level basic information of the most recent status and the date, then you can click download work list and the entire work list will be downloaded for you. Just to also make you aware, the automatic status that is set for managing referrals is anything that's an active referral only. So if it's an active referral only, you're going to see it in the pending, accepted, enrolled status. However, anything that has been rejected, completed, disenrolled, expired, or closed is not automatically shown here on your work list. However, if you wanted to access that, you would just come up here to the upside down Christmas tree and you're going to click on that. And you can easily add those to the list here. So once you click on them, they will automatically upload and add those additional referrals here. So as you can see, we now have 35 different referrals. You can also, if you want to reset it really quickly, you can just hit reset and it will automatically reset to those active statuses. Once you access that file, then you'll be able to go into the actual referral. So now that you can see, we're at the top of the referral. So within the referral, you're going to have the general referral information. You're going to have the referral ID here. That's the same ID that goes with the confirmation email that a referral was completed, as well as the referral date and time. You will then also have the general patient information here. This will all be grayed out because this was information that the ACCU team completed when they sent to you. And then you'll also see this general patient insurance where they just chose Medicaid. Then you'll also see what referral program it was sent to, which will be your program. So it will either be the MCO team that you'll see here, or it'll be the public health team. And then you'll have an attachment. You won't have all this information, but you will have the attachment here. So here where it says attachments, you are going to click, and you have a couple of different options here. So you can close it, you can view it, or you can download it. So this is the actual MPROF form here that the ACCU team attached to your referral form. So this definitely needs to be completed here in the referral form you receive. If you don't, then you will need to reach out to the ACCU team to make sure that they send you that attachment. So we're just going to click view. You can also download it for yourself and keep it for your records, or keep it in your EHR if necessary. So this is just that completed MPROF form that had all the different information that was completed on that specific referral. So we're going to close this one here, and then it will have who submitted the referral, and then journal entry information with this. So I'm going to actually reset this to pending. Okay, so when you first get a referral, it'll have automatically in pending status, and you'll get to make a decision on if you want to accept or reject the referral. The MDH team is providing you guidance on when you accept, reject, as well as the other status updates in the journal entry here. For example, if you hit reject here, you would then be prompted to this window for reason for the rejection. And there's a multitude of different options. There is also a free text box here to be able to add additional information on the reason for the rejection. But for this purpose, we're going to accept the referral. So as you can see, the most recent status is up at the top. So it always starts at pending, and then I had accepted it. And then because I wanted to reset it because I made an error, I came up to the top here and I chose reset to pending, which resets the entire status back to pending. The only time you can't reset it back to pending is when you have completed the entire referral form. If that happens and you do need a reset, you would have to put in a ticket with CRISP for that to be updated. Here's the different statuses: completed, enrolled, disenrolled, and accepted. For this workflow, you will never be using disenrolled, so you'll only be using the completed, enrolled, and accepted. Again, as I stated, you will receive feedback and information from MDH on specifically what to do with the different statuses. So please keep that handy when you are updating your referrals. And then there is this journal entry here. So referred to WIC. You can put in any kind of comment here and hit submit journal, and it will automatically show up here at the top. And that information will be available to you. So that's how you will manage those individual referrals. If you need to go back to your main work list, you would click back to work list, and you'd be able to manage all of your referrals as needed. If you do need to submit a referral for someone, let's say you have another identified need for them, you're going to come back to your main home screen, and you're going to put in the first, last name, and date of birth for your patient here. And then you're going to click on their name, and additional apps will come up here. You have to be within a patient's name in order to create a referral. So once you're in the patient's name, then you would hit create referral. And then this is the main search program that comes in. If you wanted to send a referral to a community-based organization, and you know the specific name, you can search by name. So we can put in example Meals on Wheels here. So we'll put in meals. And as you can see, there's a couple of different options to send to Meals on Wheels. Or if you're not sure what you would like to use or what services are available, you could type in food services, and then you can put in a certain radius if you wanted to, and we can say 15 miles. You can be as specific as you want in that search category. The main thing I want to orient you to is if you want to send a electronic referral anywhere that it says HIE directory and has that box next to it, you're able to send that electronic referral. If it has Maryland 211, see there's no box here. Maryland 211 is just resources available to you. So use that as a resource directory. So we are directly connected to Maryland 211. And they have over 7,000 resources available across the state to connect people to. So you would be able to give them the phone number and additional information about the program so that the patient could outreach them. However, if you wanted to send an electronic referral, you would just choose what organization that is. You're going to click the box next to it, and you're going to do create referral for program. Up at the top here, that patient information will auto be filled out. You're just, again, going to want to make sure that that phone number is updated. You're going to want to put in the patient information, which is the insurance information, which is just the main carrier type. You do not need to put in the additional information. And then here's where you're sending the referral to. This is a free text box where you can put any information you want, such as patient needs interpreter. And then if you had an attachment or anything else to share, you can include that here. And then you're going to select that you're the one submitting the referral. You do not need your NPI, so don't worry about that, but you do need a telephone number. And then you're going to click that box to let us know that the patient is aware that the referral is going through CRISP. And then you're going to hit the submit button. Once you hit that submit button, you will get an email confirmation, such as this, that says what program the person was referred to, the description of that program, and then that overall confirmation number for your records. So you will also get this every time that you submit a referral. You will also receive an email with this information. So that's if you are interested in sending additional referrals to community-based organizations, and you can always come back and search other categories or areas that you may be interested in. Thank you so much.